Your phone already knows more about your body than most people realize. It knows how many steps you took, how long you slept, when your heart rate jumped, when your breathing changed, when you stopped moving, and even when your daily routine quietly breaks. But here is the uncomfortable question. If your phone can collect all of this health data, could it one day become your personal doctor? Not just a fitness tracker. A real health companion that notices warning signs, explains what they might mean, and tells you when it is time to get help. The answer is exciting but dangerous, because the future of healthcare may not begin with a hospital visit. It may begin at 2:14 while someone is asleep, when a sensor records a strange drop in oxygen, a rise in heart rate, and a breathing pattern that looks different from the last 30 nights. By breakfast, the app does not say, "You are sick." It says something more careful. Your pattern has changed. That tiny difference matters. In this video, you will see how phones, wearables, AI apps, and home health devices are turning everyday people into better observers of their own bodies. You will see what science supports, what is still early, what companies exaggerate, and the mistake that turns data into fear. Most people do not get sick in one dramatic moment. The body usually whispers first. A little more fatigue, poorer sleep, a mild fever, less movement, a glucose spike, a cough that slowly gets worse. Humans are not designed to notice tiny patterns across hundreds of daily signals. We remember how we feel today. We forget what normal looked like 2 weeks ago. A parent checks a child's temperature and wonders, is this serious? A worker feels chest tightness and asks, is this stress or something worse? A fitness beginner wakes up exhausted and thinks, maybe I am lazy, when data suggests poor recovery. This is where the phone enters the story, not as a miracle doctor, as a memory system for the body. A phone can become a health hub in 3 ways. First, it collects signals. Some signals come from the phone itself: movement, camera images, microphone input, screen behavior, and daily routines. Others come from connected devices: watches, rings, blood pressure cuffs, glucose monitors, thermometers, and sleep sensors. Second, the app turns raw signals into patterns. Your heart rate alone is just a number, but heart rate plus sleep plus activity plus temperature plus symptoms can tell a bigger story. Maybe you trained too hard. Maybe you are stressed. Maybe you are getting sick. Maybe the device made a bad reading. Third, AI tries to interpret the pattern. This is where things become powerful and risky. An AI health assistant may explain what a symptom could mean, organize data before a doctor visit, remind you to take medication, or suggest when a situation sounds urgent. Some regulated medical software can support clinical decisions, but many consumer apps are wellness tools, not medical devices. That is the line between this may help you understand your body and this has been evaluated for a medical purpose. Here is what is established. Phones and connected devices can help people track health behaviors, movement, sleep routines, medication reminders, heart rate trends, blood pressure logs, glucose readings, and telehealth communication. Doctors already use remote monitoring for some patients with chronic conditions, especially when the device is reliable, the patient is trained, and a care team reviews the data. Public health guidance supports telehealth interventions for risks and conditions including hypertension, diabetes, asthma, obesity, and cardiovascular disease. That is the strong side. But now comes the warning. A phone does not understand your body the way a clinician does. Research on symptom checker apps shows mixed accuracy. They can be useful for basic guidance and access to health information, but they may miss important conditions, over-triage minor symptoms, or give possibilities that sound scarier than reality. Wearables can detect some heart rhythm patterns, especially atrial fibrillation signals, but many are not continuous medical monitors. A smartwatch may miss an event if it is not worn, if charging, if the signal is poor, or if the rhythm is not one the algorithm recognizes. Early studies on phone-based sensors, camera-based measurements, and AI voice analysis are promising, but promising is not proven. A model that performs well in a controlled study may struggle in real life across different skin tones, ages, devices, lighting, movement, accents, diseases, and habits. This is why medical evidence matters, not because technology is weak, because the human body is complicated. Used wisely, your phone can become a powerful health assistant. Start with baselines. Do not obsess over one number. Learn your usual range. What is your typical resting heart rate? How many hours of sleep do you get? What does your blood pressure look like across several days? Patterns are more useful than panic. Second, use your phone to prepare for medical care. Before an appointment, write down when symptoms started, what makes them worse, what improves them, what medication you took, and what your device recorded. A clear timeline can be extremely helpful. Third, use alerts as prompts, not verdicts. If your device warns about an irregular rhythm, low oxygen, very high heart rate, or unusual pattern, do not diagnose yourself. Recheck the reading if appropriate, notice your symptoms, and contact a qualified professional when the signal's concerning or repeated. Fourth, combine data with basic health behavior. The smartest app cannot replace sleep, movement, hydration, nutrition, medication, and checkups. A phone can remind you. It can make invisible habits visible, but you still have to live the data. And this is where health technology becomes both exciting and dangerous. The first risk is the false alarm. A sensor slips, a watch is too loose, a finger is cold. The camera reading is affected by light. The app sees a strange pattern and sends an alert. Suddenly, a healthy person spends hours searching the internet and imagining the worst. The second risk is false confidence. This may be even more dangerous. A person feels serious chest pain but says, "My app says my heart rate is normal." Someone has stroke symptoms but checks a smartwatch instead of calling emergency help. A parent sees a normal number and ignores a child who looks very unwell. A normal app reading does not always mean you are safe. The third risk is privacy. Health data is intimate. It can reveal pregnancy patterns, sleep problems, mental health signals, medication use, location routines, and chronic disease risks. Some health apps are covered by strong health privacy rules. Others are not, depending on the country, company, and data use. Before you give an app your body, ask, who sees this data? Is it shared for advertising? Can I delete it? Is it encrypted? The fourth risk is marketing language. Clinically inspired is not the same as clinically validated. AI-powered is not the same as accurate. Doctor recommended is not the same as approved for diagnosis. A beautiful dashboard can still be wrong. This video is for educational purposes only and should not replace advice from a qualified healthcare professional. If symptoms are severe, sudden, or worrying, seek medical help instead of waiting for an app. The next stage could feel almost invisible. Your phone may notice that your walking speed has changed. Your voice sounds more tired. Your sleep has fragmented. Your resting heart rate is rising. Your blood pressure cuff keeps sending higher readings. Instead of one dramatic alarm, I may build a risk picture over time. For people with diabetes, hypertension, heart disease, asthma, or sleep problems, this could support earlier conversations with clinicians. For elderly users, fall detection could bring help faster. For rural patients, telemedicine and home devices could reduce the distance between symptoms and care. But the future will also raise hard questions. Who owns the data? Can an algorithm be fair? Will people without expensive devices receive worse care? What happens when confident AI advice is wrong? Will companies design for health or for engagement? The best future is not a world where everyone stares at health numbers all day. It is a world where technology quietly supports better decisions and steps back when human care is needed. Maybe the phone will never become your doctor. Maybe that is the wrong dream. A doctor does more than read numbers. A doctor listens, examines, questions, connects clues, understands risk, and carries responsibility. But your phone may help you reach the doctor sooner with clearer information before a small problem becomes a crisis. It may help a parent notice a fever trend. A worker understands stress before burnout. A patient tracks blood pressure before damage builds silently. A beginner realizes that recovery is not laziness. An older person gets help after a fall. The future of healthcare may not replace human care. It may surround it quietly, on a wrist, in a pocket, beside a bed, inside a simple app that notices what the body has been trying to say. Technology can measure the body, but wisdom is knowing what the numbers truly mean.